A very warm good evening to all and a happy World Pharmacist Day. The greetings of pharmacist, being a pharmacist, wishing you a very happy Pharmacist Day. Pharmacist profession where you can make the medications and you will be help the patients through the patient safety, dispensing the medicines and making the lives throughout the year. This year, the theme for World Pharmacist Day is pharmacy, always trusted for your health. Yes, health is always required to be a healthy person, and when you have to be make your health, you always need to discuss with your pharmacist. And today we are organizing a webinar, a short webinar on the topic of impact of COVID-19 pandemic on the educational system. Today we are having with us Professor V. Gopal, Principal, Government College of Pharmacy, Pondicherry. Sir is having the very much tight schedule, and out of his busy schedule, sir has joined with us and will give you some interesting knowledge about the pharmacist and what things we are facing currently and what things in future. Like he, sir will give you the indeed motivation to all. Now I would like to hand over the session to Professor V. Gopal. Over to you, sir.
Happy evening, one and all. Am I audible?
Yes, sir, you are audible.
Thank you. At the outset, I would like to wish all my fellow pharmacists a very happy and a prosperous World Pharmacist Day. My dear friends, one of my student who is having a pharmacy in front of JIPMA, that is Jawaharlal Nehru Institute of Postgraduate Medical Education and Research, he started a new practice. During the pandemic time, when the patients were approaching him for medicine with the prescription, when he was dispensing and honoring the prescription, along with the prescription, for each and every patient, he was giving one balloon. So the patient were taken back. So why are you giving me this balloon? He said, this balloon is given to you for free. You will have to use it and blow the balloon minimum 20 times a day. Then the patient asked, why should I do it? Then he explained it to him. My dear patient, this is a period of pandemic COVID-19. So to overcome this pandemic, you need to have a very strong vital capacity. So vital capacity is something that deals with the capacity of your lungs. You can improve your vital capacity by blowing a balloon. So this is a simple exercise that will help you to improve your vital capacity and protect your lungs. So this will also protect you from COVID-19. So this simple step that was done by my student, a pharmacist, was appreciated by the community. And today, when the COVID-19 has become silent, the patients remember him, come to him, and greet him on this World Pharmacy Day. So he was so happy and overwhelmed that he called me up and said, sir, I am having this medical shop for so many years, but nobody has wished me on the World Pharmacy Day because of one gesture that I was interested in their health, because of the idea that I gave them. They have become so happy. People are pouring into my pharmacy to wish me happy Pharmacist Day. So, my dear friends, this incident gives us a beautiful insight that we should be useful to the community. If the community feels that we are useful, then our profession will grow. So, this is a message that we will have to take home and practice during this World Pharmacy Day. My dear friends, today I remember Francis Oldham Kelsey, the first regulatory pharmacist in America. We all remember the disaster of thalidomide disaster. This thalidomide disaster has created havoc all over the world. But in America, not even a single child has been affected because of Francis Oldham Kelsey, the regulatory pharmacist who prevented the manufacturing, sale, and distribution of thalidomide in America. So, this responsible pharmacist children and the pregnant women there. So in India. So today we will pledge that we will act as responsible pharmacists and serve our community. My dear friends, many fathers, when they play with their children, children in the sense young ones, very small young ones, maybe 2-3 years old, we have a habit. We throw the child into the air and then we catch it. So when the child is in the air, the child feels so happy and it starts laughing. So the child feels happy and it laughs in the So, my dear friends, yesteryears was different, but today the period is different. My brother-in-law had a headache, so he went to a nearby pharmacy and then he asked one
Sir is mightly having some connectivity issues. We are trying to reconnect with Professor Gopal.
hello, am I
Hello, sir.
audible?
Yes, sir, you are audible.
Hello. Thank you.
Yes, sir.
Because I'm traveling, my internet got cut. Uh,
Yeah, yeah,
so
yes.
my brother-in-law, who had a headache, he went to a nearby medical shop and he asked for an analgesic. The person in the medical shop gave him an analgesic, and then my brother-in-law asked him, "Are you the owner of this shop?" He said, "No." "Are you a pharmacist?" He said, "No." Then he asked, "Where is the pharmacist?" He said, "The pharmacist is having severe headache, so he has gone out to have a double strong tea." So on hearing this, my brother-in-law became very anxious, and then he asked, "See, I'm having a headache. I asked you for an analgesic, but when a pharmacist is having headache, he is not taking an analgesic. Instead, he is going and having a tea. So if I have a tea, will I be able to overcome my headache? In that case, why are you not advising me to take tea, and why are you prescribing me an analgesic?" So this is a valid question that he asked. And the pharmacist replied, "Sir, tea contains caffeine. So caffeine is a central nervous system stimulant. So if you are having an occupational hazard and if you are having headache, a tea will cure it." But when I say this, the community is not accepting. They want a medicine. That is why I'm giving you a medicine. So my dear friends, this is how we need to build our trust. So we need to be open. We need to create awareness among the public that there are methods of preventing a disease. We should concentrate on those methods rather than always going for treatment. My dear friends, I similarly had one more occasion where where one of my friend who is suffering from hypertension, he went to meet a MD general medicine physician. The physician is a very reputed physician in Pondicherry, and we need to get an appointment to meet him. He went with an appointment, but he was not able to meet him because the doctor was practicing yoga. So it so happened that they had to wait for half an hour, and then the physician came back, and then my friend showed him his report. He went through all his blood pressure measurements over the week, and also the prescription pattern that he was following. And then he said, see, your blood pressure is not under control, so you need to take more medicine. So I am doubling the dose. So he doubled the dose, and then he gave him a new prescription, and then he asked him to take that medicine. Out of curiosity, my friend asked the MD general medicine doctor, sir, were you practicing yoga before coming and counseling me? The doctor said yes. Then why do you practice yoga? The doctor said, sir, for the past 5 years I am suffering from hypertension, so if I practice yoga I can get myself cured. That is why I am practicing yoga. Then he asked the doctor, sir, in that case, why don't you prescribe the same yoga exercise to me? Why are you doubling my dose? Then the doctor gave the same thing. See, what does the community expect from a doctor? Only medicine, not advice. So when I say advice, people are not ready to listen. If you are ready to listen, I will teach you all the yoga exercise that will help you to recover. He learnt all the yoga exercise and he is practicing, and his hypertension is now under control. So my dear friends, creating awareness among the general public on health is the important work that we pharmacists should undertake to create trust. So today, my dean, who is a physician, he was very sad. Then I asked him, sir, what is the reason? Why are you very sad? So he said, in his doctor's WhatsApp group, there is a WhatsApp. He showed me that WhatsApp that was very shocking. In that WhatsApp, it is written, a patient cured is a customer lost. I repeat, a patient cured is a customer lost. So, what a worst statement this is. We cannot consider a patient as a customer. Our aim is to cure the customer, but off late that is lost, and a patient is considered as a customer. So once if it is considered as a customer, then there will not be cure, there will be only management. There will be always a method to keep the patient as a continuous patient, as a regular patient, as a patient forever. So this is not the objective of a pharmacist. We are not interested in managing disease. We are interested only in cure. And this is possible by a pharmacist by creating awareness in the general public on health issues. Pharmacist is an authority on medicine. He is the maker and messenger of medicine. He has a complete knowledge on medicine. So this knowledge he will have to decipher to all the community people and create awareness. So this is very, very important. We pharmacists are dedicated to give health, good health to the people, especially the community. So, my dear friends, especially post pandemic, post COVID-19, many of the people are having post COVID-19 complications. To overcome these complications, they do not have a proper access. So, we pharmacists should be a bridge between the patient and the physician in overcoming this post COVID-19 complications. So this can be done only if we are knowledgeable. We need to keep ourselves update with what is the current trend, especially in the field of post COVID-19 complications management. So updation is very, very important. If we don't update ourselves, then we will become outdated. So updation is very, very important. So this updation is possible only if we cultivate the habit of reading regularly. So off late, because of our professional pressure, we are unable to keep ourselves update. but that is a very, very bad practice. So we need to keep ourselves update by reading all the journals and keeping our knowledge with par with what is going on. So my dear friends, I am also able to remember the great service of a pharmacist from Andhra Pradesh by name Chilikuri Paramatma. This pharmacist from Andhra Pradesh is the person Chilukuri Paramatma who went to court and made the court order to the medical council that all doctors should write their prescription in capital letters. One man, that too an A2 pharmacist, a pharmacist with only diploma qualification, he is able to make the court instruct the doctors to write their prescription in capital letters. The whole world is appreciating this pharmacist, Chilikuri Paramatma from Andhra Pradesh, but we Indians, we are not recognizing his service. We need to learn from him that we should be brave and we should fight for what is right for our community. This fighting spirit and this braveness is very important to our pharmacist. On this World Pharmacist Day, we should owe to fight for the welfare of our pharmacist. So, my dear friends, today we should remember the great services of Professor Dr. M.L. Shroff, the father of pharmacy in India. Professor Dr. M.L. Shroff, the father of pharmacy in India, has done great service to our pharmacy profession. One pharmacist from New Jalpaiguri Hospital approached Professor M.L. Shroff and asked him, "We are 11 pharmacists in New Jalpaiguri Hospital, but we do not have recognition. So what should we do?" Then Professor M.L. Shroff said, "Today is Sunday, tomorrow is Monday. From Monday to next Sunday, every day morning at 11 o'clock, through the New Jalpaiguri Bazaar Street, you undertake a silent rally." Then the pharmacist asked, "What will happen? You do this and then I will let you know." Next day, Monday, the 11 pharmacists wore their apron and with placards. Pharmacist is an authority on medicine. Pharmacist is the maker and messenger of medicine. Pharmacist is a person knowledgeable and one source of contact for all information on medicine. So with this placard, they went on a silent rally. So Monday they went on rally, people did not notice them. Tuesday when they went on rally, people noticed them. Wednesday when they went on rally, people read what was there on the placards, and on Thursday they greeted them. On Friday they were waiting for them. On Saturday joined them, and on next Sunday they had a felicitation for the people who were in the rally. So the chief pharmacist rang back to Professor M.L. Shroff and said, "Sir, we went on rally for 7 days, and at the end of 7 days, the people have recognized our profession and they have given us an overwhelming welcome. So we are very happy, sir." From that day onwards, when the general public come to the hospital after meeting the doctor, after getting the prescription, they used to be very open with the pharmacist, chat with him, get his advice, and they were all very healthy, and they recognized the pharmacist in New Jalpaiguri. My dear friends, this experiment done in New Jalpaiguri should be done in each and every state in India. So the people know the greatness of pharmacist, but it has to come into this media, especially the local media, so that it will reach the general public. I am here to appreciate this OPF, this experiment done in New Jalpaiguri, undertaking a competition for the school children, doing social work. So all this will be very much beneficial. So I request each and everyone to see that our celebrations of the National Pharmacy Week, this World Pharmacy Day is highlighted in the media, especially the local media, so that it will reach the general public. I am here to appreciate this OPF. This OPF has today made a beautiful program with all the pharmacy profession in a small get together. We will be able to greet each other by sharing our knowledge. meet each other, share our experiences, share our ideas, and we can progress with a win-win situation. My dear friends, one of my student, when he was dispensing the medicine, I just happened to observe the patients. One patient that is given here is not effective. The other patient replied, no, no, it is very effective. The first patient said, I have taken a full dose of medicine, but my fever is not under control. The second patient said, I have also taken a dose of medicine, but now my fever is under control. So which capsule did you take? So she showed a capsule. So she said, I am also taking a capsule of similar color, but it is not having any effect. So the first patient said, how did you take the capsule? The second patient said, I just swallowed it. The first patient said, that is wrong. So you should swallow so that the green color crown goes first and the red color body of the capsule goes next. So this is, I am saying here that the people are superstitious with medicine. A capsule, however you swallow, will have the same effect. It is not going to have any different effect when you swallow crown first or body first. But people build such superstitions, and such superstitions affect the medicine and the way in which it is given. So, to know and break this superstition among the patients, we should be close with the patients. So, only when we are close with the patients, we will be able to appreciate we will be able to appreciate the mistakes that they commit and how to rectify them. The other day, one patient was having her tablet without water. So, when a tablet is taken without water, then there will be no disintegration, there will be no dissolution. The patient may have more side effects like ulcers. So, we pharmacists should rectify such small mistakes. The other day, one patient was storing the capsule on the fridge top over a stabilizer. So, because of the heat of the stabilizer, the capsule has melted, and that melted capsule he was consuming. So, we should create awareness to the general public on how to store the medicine. Many people take tetracycline at night with milk. So, we should teach them that tetracycline is contraindicated with milk. So, these small issues, when we set right in the general public, then the public will build confidence on us. When they build confidence on us, then it will be called as a trusted pharmacist and a trusted pharmacy profession. So to build that trust, the first thing that is required is knowledge. When we have that knowledge, the people will accept us. The second thing that is required is we should be good communicator. So when we are good communicators, we will be able to communicate to the general public that what are all the positive things they should be taking up with the health. So being a good communicator, being a good educator, this and all is very important in being a useful pharmacist, a trusted pharmacist in our society. So the World Health Organization has given out the skills that is required to be an ideal pharmacist. We should develop that skills. We should keep ourselves updated. On this World Pharmacy Day, we should pledge that we will be useful to the community and see that our community is healthy. Let us all work for health for all in the near future. I once again appreciate, congratulate, and thank OPF for giving me this wonderful opportunity of interacting with this enlightened minds. I wish you all again a very happy and a prosperous World Pharmacist Day. Happy World Pharmacist Day. Please forgive me because I am traveling. There is some changes in the signal strength. The lighting is not sufficient, so I am not visible properly, but still bear with me, and we will all work for bringing our profession to the forefront. Jai Hind. Thank you.
Thank you so much, sir, for your wonderful marks to our audience, and you have like done a very good job to our audience. You are since traveling, and you have given a enlightened motivation to our audience who have joining the session throughout the timings. Now, on the precious occasion of World Pharmacist Day, we are going to be launch one of our Oracle session series that will consisting the interviews of the personalities of the pharmacy profession throughout the India. These are the OPF Oracle sessions we will be launched every month with a one interview series. Team OPF always bringing you on a new platform, and we are encouraging the such youths who are interested in building the career in the pharmaceutical profession. We are always welcoming them to share their ideas, and our platform is ready to everyone. If you are having some innovative ideas and if you are working throughout the sessions, we are bringing you the provide you a platform for the industry professionals, and all the industry professionals will come together and having such interactions with the platform, and you can interact with directly the higher level staff of the industries like CEO, MD, and the president level staffs of the pharmaceutical industries. We are bringing you with the Oracle sessions and new innovative things. We are coming with the new solutions for the your studies with the upcoming next 1 year. We are building our services through the providing best knowledge to a budding pharmacist, and those who budding pharmacists interested in the research and development or any other activities who are facing some career related issues, we are always here to help all the students or all the professionals who are having some difficulties in their mind. Or this session always be open. The platform we have created, this is for the students who have like joined the sessions and interested in building the things. We are always to encourage all students who have joining, who are facing the problems in the colleges, who are not having idea like what should they have to be do, what the right thing they have to be do, what is the right thing, what is the wrong thing, how they have to be proceed. The small things we are helping the students in the near future, because you are having a long future ahead with the great pharmacy profession. And in the India, having a biggest pharmacy profession, you are knowing that India is the world's number one uh, formulation units having. So these units we are helping students to become interact with the industries directly, and how you will be having such things. You can connect with the team OPF, and team OPF is always here to help you, embrace you, and motivate you in the near future. Thank you everyone for joining with us, and I have shared you the link of feedback session for this webinar. You give your valuable feedback through the feedback, and your feedback is really appreciable for us, and we are looking forward to work with you, work for you, always like we are ready to improve our motivation. Thank you everyone. And also I would like to thank Professor V. Gopal, Principal, Government College of Pharmacy, who have motivated you through this session out of his very busy schedule. Sir is traveling throughout the sessions, but whatever the great sound knowledge Sir is having, Sir has motivated us through his best of knowledge, and sir always like giving a great inspiration to me also, and our entire team of OPF. Sir is motivating and giving the great knowledge. Thank you sir for joining with us and giving your valuable time to our audience. Thank you so much sir.
Thank you very much. It is my pleasure. I always cherish being a member of OPF family. Thank you very much. Together,
Yeah,
we
thank
will
you
see
so
that our profession achieves great heights. Thank you. Thank you. Happy World Pharmacy Day. Jai Hind.